these are going to be the hip special tests from the lab. So for the first one, I'm going to do the Kendall's test. And this one's going to be for hip flexor tightness of your iliopsoas or your rectus femoris muscle. You'll ask your patient to stand up against the edge of the table, their glutes touching the edge, and then you'll ask them to lift one of their legs and slowly, gently roll back onto the table while bringing their knee towards their chest as far as they can. What you're looking here for is the opposite leg. If they have tight iliopsoas muscles, the leg will typically be off of the table, the thigh won't be flat to the table. If they have iliopsoas and rectus femoris tightness, then they're going to not only be lifted off the table, but the knee will be slightly extended, around 70 degrees. If they just have rectus femoris tightness, the thigh will be flat on the table, but the knee will be more in extension. One thing that you want to look for is make sure that your patient doesn't have an excessive lordotic curve, like beforehand, before they actually lay flat on the table. That might affect some of the testing that you get. You just want to slide your hand underneath their back and make sure that it's nice and flat against the surface. The next test that you can do is you have the patient slide back onto the table. This one's going to be a straight leg raise. So this one we're using mainly for hamstring strain or tightness. It can also be used to test for lumbar issues such as herniated discs, where you'll be dealing more with like a radiating pain with a positive sign. But for hamstring tightness, what you can do is this is going to be a passive test. So we want to take the leg actually up into a straight leg raise, and if they report any pain between really the smaller degrees of change here between 30 and 70 degrees, that would be indicative of some sort of hamstring strain or tightness. If you are using this potentially to look at disc herniation problems, you can get a false positive if the subject has tight hamstrings. So one of the ways that you can eliminate that is with that leg that's not being tested. Get it propped up here in a flex position, which relaxes those hamstrings and puts your pelvis a little more relaxed in a neutral position, and then you'll do your straight leg raise. And any type of radiating pain you get there would be associated with some sort of lumbar issue. Another one that we can do is the Nobel test. So that's for IT band tightness. There are quite a few IT band tightness tests, but we chose to do the Nobel test. It's a pretty simple one. The IT band is located on the lateral side of the leg, originates up the lateral hip and comes down and attaches at the knee. And so to test this, you'll want to bring the patient up into hip flexion and knee flexion. You want to really grip that lateral condyle with your thumb, nice and tight, and then you're going to passively extend the lower knee or the lower leg here. And if it's really tight, you actually might be able to feel the IT band snapping over that lateral condyle. But if you're holding it quite securely, then what will happen is this will be actually a very painful movement right where your thumb is at. And people might even have a little bit of a limited range of motion, might not be able to fully extend, only coming up to about here. One of the other tests that we can do is the Faber test. So this is going to be our flexion, abduction, external rotation. That's what Faber stands for. Looking for SI joint pathology. Also can help you determine whether or not they have a labral tear or iliopsoas tightness. So you'll instruct the patient to bring their leg up into flexion, abduction, external rotation, resting their foot on their opposite knee. If they have iliopsoas tightness, you're going to see right away that they're not going to be able to lie their leg very parallel to the table. It's going to be more up in like this type of a position. In order to perform this test, you want to make sure to stabilize the opposite hip, and then you're going to want to push down on that knee. Any type of pain or discomfort that they might feel during this test would be positive. If you have a lack of a range of motion compared bilaterally, that would be a positive as well. Any pain that they report or discomfort in the back near the sacrum, that's going to be your SI joint pathology. Anything that they're reporting actually feeling pain like inside of their hip, that's going to be more indicative of a labral issue, like a labral tear. And then again, inability to really get a good range of motion here would be Iliopsoas hip flexor tightness. It's a good test for a couple of different issues. Another one that tests some tightness in the piriformis muscle, which is one of our deep posterior muscles behind the glutes. There's a lot of external rotation, is the piriformis test. So for that test, you'll want to ask the patient to lie on their unaffected side. And while on their side, we'll have them move their bottom leg will be straight. Move the leg that you're testing up so that their foot is right here behind their calf. Knee is slightly flexed. Stabilize here at the hip, and then you're going to again apply downward pressure to the knee. Lack of range of motion, pain in the glute region, that's going to be indicative of piriformis tightness. And of course, we're going to compare bilaterally to see if we have a lack of range of motion. And then the final test for this lab is the Trendelenburg test. So you'll instruct your patient to get up and face away from you, so you're looking at their backside. And for this one, what you're going to want to do is really locate the posterior superior iliac spine, your PSIS. Remember at that dimpled area here in the back. And what you'll ask them to do, you can test this with your thumbs here at the back, with your fingers up on the iliac crest, and ask them to perform it so you can actually feel the movement in the hip. But you also want to take a step back and observe how the patient moves. So you're going to instruct them to lift up their right leg in this case, flex it back behind them, and what you should see is you should see this hip, this side of the hip, the one that the leg is lifted on the right side. You should see that actually go up, and the reason that is because this glute muscle should engage, which should stabilize the hip altogether. If instead their hip actually drops lower than the stabilizing side, that's going to show that this is not being engaged as much as it should be, and therefore you have some weakness in the gluteus medius. And so that is the Trendelenburg test. And you want to test bilaterally to see if you have bilateral weakness or if you just have unilateral weakness. You can have either or, and people that have a lot of weakness in those lateral stabilizers will often take on a gait in which their leg actually somewhat swings out to the side as they walk, rather than walking more in a straight path. So those are the tests for this particular lab.